Good day to you. Let me take you to the presentation of these 5 minutes, explaining to you mini proposal developing an anti-stigma campaign for increasing of mental health awareness among nursing students in Indonesia. Contents. I'll be presenting to you the first introductions about the research problem and research objective. The second, literature review. And the third, research methodology includes data collection methods, sampling techniques and participants, and measuring techniques. Introduction. WHO 2022 states the stigma associated with mental health condition is one of the biggest obstacles to demand for mental health care. People who have mental health disorder are the target of pervasive prejudice and stigma around the globe. The community is highly stigmatized and prejudiced. In Indonesia, as well as much of the world, mental health issues are a major difficulty. There of information, a high rate of stigma, and a lack of local resources, including physicians, psychiatrists, and other mental health professionals, are all problems in Indonesia. Nurses and nursing students frequently have stigmatizing attitudes toward patients with mental illness, which has a negative impact on patient outcomes. Most nursing students will eventually work as frontline healthcare providers, where they may come into contact with people who have mental illness like schizophrenia. These individuals may give lower quality services as a result of prejudice or discrimination. The research problem or problem statement. This study is trying to answer the subsequent question: how to develop an anti-stigma campaign for increasing of mental health awareness among nursing students in Indonesia. And research objective. This study aims to develop the anti-stigma campaign for increasing of mental health awareness among nursing students in Indonesia. Literature review. Patients with mental illness are frequently stigmatized by nurses and nursing students, which has a negative impact on patient outcomes. Evidence from high and low income countries suggests that anti stigma interventions can improve public attitudes, reducing discrimination experienced by people living with mental health conditions. Anti-stigma interventions, particularly social context strategies, through which people with lived experience help to shift attitudes and actions, can also reduce stigma and discrimination in the community. We're moving to research methodology. The studies and action research in design. The planning, acting, observing, and reflecting phases of Camus and McTaggart action research method 1988 were used as a framework for the current study. Data collection methods. The current study will use a variety of data gathering techniques such as individual and focus group interviews, participants' observations, field notes, photography, and documented data source. Every cycle of the action research will employ these techniques. Participants and measuring techniques. The study will be implemented within the higher education of health in Indonesia. Then students, representatives from each of the first through 7 semesters will take part in a focus group discussion utilizing the established FGD procedures. All 200 students will complete the AQ27 questionnaire, which will be used to measure stigma. These are references that have been provided. Thank you very much and have a great day.